Yes, good afternoon. My name is Dr. Charles Ayume, Member of Parliament, Koboko Municipality, and I chair the Parliamentary Committee on Health. As you are aware, this week His Excellency the President assented to the Uganda organ donation and transplant bill. It's now an act of Parliament, and really this has caused a lot of excitement amongst the medical fraternity, but also most importantly the Ugandans. Now, it's a very important bill. It's a novel area of practice in Uganda. And we started working on this bill last year. We passed it as Parliament in September. And the President decided to, I think, take his time in trying to appreciate the bill. And I think that's why it has taken him longer than usual. But the most important thing is that he has assented to it. Now, this bill really sets the legal framework, the legal environment in which human organ donation and transplant can be conducted. And of course, there are several, different tissues and organs that can transplant, right from skin, from bone marrow, to hair, to kidneys, to cornea, and so forth. Of course, the flagship for any country is kidney. Now, we are seeing that the number of Ugandans who are on dialysis, and dialysis is caused by kidney failure, meaning your kidneys are not able to filter blood. And when you don't filter blood, then you get urea, creatinine, and other components that should ideally be excreted, building up in the body, and it's very harmful. So you have to use what we call an artificial kidney. That is the process of dialysis. Dialysis is very costly, even to the average Ugandan, even to the rich, because you're paying in private facilities, you'll pay between 500, 600,000 per session. You need about 3 sessions a week. That's between 1.5 to 1.8 million shillings. However, in Mulago and Chirudu, the dialysis is subsidized to about 120,000. That is really because there are consumables that you use, including the filters. And so government subsidizes to the tune of about 70%. Now, the long-term solution ideally would be a kidney transplant, and that is what the modern world is doing. But not only the modern world, we've seen Kenya has been doing a kidney transplant. I think Rwanda launched recently, Tanzania the same. So we are behind. So the bill is very timely. And I want to assure Ugandans that we are ready as a country. When Mulago was being renovated, the provision for organ transplant was factored into, and we have the infrastructure that's ready. We have kidney transplant surgeons who are undergoing training. So we anticipate that they'll work alongside experts. Eventually we shall be weaned off. And in about a year or two, our Ugandans would comfortably be able to conduct kidney transplant on their own without any other external technical support. And this year, I would want to thank Parliament of Uganda, especially the Budget Committee, that were given 1.5 billion shillings. So that, because we anticipated that the President was going to assent to the law, which he did. So the coming financial year, there will be 1.5 billion shillings set aside for kidney transplant. I also must say the private sector has been waiting for this bill. There are facilities that are ready to do cornea transplant. So the bill is timely. Skin, when you go to Chirudu Hospital, which houses our National Burn Center, we lose a number of children per day. Yet, ideally, these children could have been saved. Children with more than 50% burns, we ideally should be able to transplant skin from their mothers to the children. With, of course, modern technology, you can also use placentas. These placentas that we throw away can also be used for skin in case of people with more than 50% burns, and also piglets. The skin of piglets grown under certain conditions can be used. So the law has been a huge limitation for service delivery. So as the chairman of the Parliamentary Committee on Health, I'm very happy it has been timely, and it's really going to save Ugandans in terms of mortality, in terms of poor outcome of care, in terms of high out-of-pocket expenditure, but also external medical tourism. Once we have that here, we are going to be able to do kidney transplant here and save Ugandans the $28,000 they have been incurring to go to Turkey or to India or to Pakistan for the kidney transplants. We shall be doing here at a very subsidized rate, and also probably our neighbors, DR Congo and South Sudan, will also benefit from these services. Of the law outweigh the demerits. One of the things is the law was put in place, and we ensured that we had to make a lot of the punitive and deterrent measures were quite stiff, both to the individual, those caught in organ trafficking, and to institutions. We want to deter people caught in the illicit trade of organs, one, to deter them, but also those who participate in, whether you are a medical practitioner, whether you are a middleman, but also the facility where this mischief has been conducted will have to pay. So we put the penalties so steep, 2 billion, some of them are life, like peddling in organ trafficking in children's parts. The penalty is extremely high because it's a very lucrative business. Organ trafficking is quite lucrative in the region and the Middle East. So we want to put deterrent measures in place, but also those who are caught abusing our children, kidnapping them to harvest organs, they should pay the price. And I've forgotten one of the clauses, but it says there will be no organ harvesting in children. However, in the case of siblings, like twins, where the science has shown once they are compatible, in the case of tissues that regenerate, like bone marrow regenerates, it's not like solid organs. Because I told you the bill looks at organs and tissue. Bone marrow is a tissue. The question is, why would you deny a sibling an opportunity to be saved in case of leukemia if his brother has compatible bone marrow and is willing to donate? So we opened that provision up. We put a sub-clause 2 and said, however, in the case of conditions like organ transplant, a sibling should be able to donate because that regenerates. We are not talking about solid organs. Solid organs like kidneys, where somebody may want to be an athlete in future at 25 years old and is asking his parents, but why at 14 years old did you make the decision to remove one kidney to give it to my sibling? And yet by now I would have been a top-notch footballer or a super athlete. So that provision opened up to tissues that can regenerate, not solid organs. Finally, in the law, organ transplant is a new area in Uganda. And some of the organs we pick can be from cadavers, dead bodies, but in the medical space we call them cadavers. Now, we are alive to the sentimental cultural issues regarding our respect for the dead. So we are saying let Ugandans first appreciate organ and tissue donation amongst living donors. We get that right for first 5 years. We monitor is there trafficking and all that. Because otherwise, if we had to open up living and cadavers, the dead people, then night dancers will also celebrate. So we are saying let us appreciate living donors, then we transition slowly after 5 years. And it's there in the law that for cadaveric donation, we shall only be able to start after 5 years. There are many penalties in the law. One that will hold an individual culpable if you're caught in the illicit trade. Because what we're going to do, there's going to be a council, an organ transplant council. So there'll be no organ donation or harvesting without approval of this council, which will be appointed. The minister will have powers to appoint this council. So this council will know whether the organ and the organ donation and transplant is being done in the private sector or within the public facilities. You will have to apply to the council. So the council is the one that's going to do the supervision of organ donation and transplant. So if you get health workers or practitioners involved in harvesting without applying to the council, donation, export, and so forth, there are going to be penalties on the supervisor, on the people who are committing, all the accomplices, the people committing the actual act, but even the establishment where that illicit activity is taking place will have to pay. If it's a hospital, the fine is quite steep. And I can't remember the exact figure, but it is steep enough to close you out of business. So I would want to tell people to be very, I would like to caution them that this is an area that we are putting in to save life. Let people not look at the financial aspect. And there's not going to be any financial transaction. It should be mutual consent. Your sibling comes, or somebody who is who has shown scientific compatibility in organs, and it should be free. There should not be any financial transaction, whether in the private sector or in the public sector.